Welcome to Harmonium LA, the podcast. I'm your host, Jessica Heedy Gandolfi, emotional wellness expert, founder of Harmonium LA, and published author. The world needs healing now more than ever. My goal is to bring you inspiring conversations, tips, and techniques that will help you build a sustainable healing toolkit. The Harmonium LA podcast is the only resource you will need to slow down, stop searching, and start healing. Welcome back to another episode of Stop Searching, Start Healing, the podcast. I am absolutely thrilled today to introduce you to a truly phenomenal woman. Not only is she a very dear friend of mine, but also a highly, highly successful clinical psychologist based here in Santa Monica in Los Angeles. And she really does have such a plethora of knowledge, education, and a really good grounding from her own experiences that she can bring into the work that she does with her clients today. Dr. Ivy Love Margulies is a licensed clinical psychologist. She's a death midwife, also known as a bereavement doula, a Reiki healer, and specializes in grief, loss, and trauma. She's also the host of the Shattered Conception podcast. Ivy, welcome to the show.
Oh, thank you so much, Jessica.
Thanks for joining us.
I'm glad to be on your show.
Absolutely. And I really, truly believe that, you're going to bring so much good content and, life experience and professional experience to the audience today. And I'm for sure that everybody listening is truly going to get something out of this. Absolutely, without a doubt. So, let's just start at the beginning because you have so much that we can dive into. But, one of the things that I love that you say is that grief is not something that only happens when somebody dies. Grief is something that happens at any kind of loss. So whether it's the loss of a relationship, whether it's a divorce, loss of a job, loss of health, of dreams, of opportunities, whatever it might be, if we have loved something, then we are going to grieve that loss. Mm-hmm. And I think that's really critical, especially now when we look at the state of the world over the last 12 to 8 months. I don't think there's a single person on the planet that has not grieved the loss of something.
Right. Or have been impacted in some way by the pandemic and, or, the change in how the family system, as we would say, looks at home for people who have children at home, to jobs, and how we now are so much more isolated from people and from connection in society, to just panic and fear of the unknown. So it all depends also on a person's temperament and personality and how they handle stressful situations. How do they handle transitions? Whether they're sudden or they're, anticipated. So it has a lot to do with also who each of us are as individuals. That said, yes, if we have something happen in our lives, we are absolutely going to grieve that loss, whether it is over a job or loss of dreams or anything really, not just death and trauma, although we tend to think of grieving associated with death.
Absolutely.
It's not. It encompasses so much more of our lives daily.
It truly does. And that's exactly it. People immediately go to that place of grief. Okay, that's shocking. Something really tragic has happened. And it can be, absolutely. And on that deep cellular emotional level as well, which will then manifest in some form in the physical. So you're able to kind of, with your clients, work through that. But let's go back to your story, because you have a phenomenal story. To get where you are right now in your life and the work that you're doing in the world with healing and psychology and seeing your clients, you didn't start that way. You started out in fashion, you trained at, Fashion Institute, you worked as a, producing, a publicity with Giorgio Armani in Beverly Hills and Rodeo Drive. You were dressing celebrities for the Oscars. You had this completely different life before the life that you have now. Talk to us about your experience and how that led you to the work that you're doing now.
I think I've always been fascinated with psychology. And then as I moved through my life and my father's suicide at the age of 15, which changed how I really wanted to, I no longer wanted to go to an Ivy League college, let's put it that way. I completely went back to my art and being more creative. I went to the Fashion Institute of Design and Merchandising out of high school. That led me to become a graphic designer. And then I ended up doing, yes, as you mentioned, PR for Giorgio Armani corporate, off Rodeo Drive for a couple of years. Then moved over to Warner Brothers and worked as a producer's assistant on many television shows and movies. And then my husband died. I was married at 24 and he died 2 months later in a car accident. And also a year after my father committed suicide, my best friend committed suicide. She hung herself in her closet. So those three major significant deaths, so in such a short span in my life, led me to go, I want to go back to school. I want to go back to school. I want to figure out what's healthy, what's normal, put order in the chaos, as I say, because all of those are traumatic events. We don't often think of PTSD, through some of these other events that happened vicariously through death of our loved ones. We often think of war veterans or people in the ICU, or you've been in a horrific car accident yourself, whatever. Anyway, this is vicarious trauma and this is PTSD. And I didn't really recognize it at the time. And there were no young widow groups at the time either for, I'm going to date myself, but this was 1990. I had to go to a therapist, and even the therapist didn't really know what to do with a 24-year-old widow. It was unique, and I felt very isolated and alone, and it was hard for me to concentrate and focus. I had all the symptoms of trauma, but no one named it for me. So it wasn't until I went back to college, went to Scripps undergrad, which is part of the Claremont colleges, wonderful school, and then on to grad school right after, thankfully, to get my doctorate in psychology. And I loved it. I loved every moment of it. It filled my soul up. It helped me put order, like I said, in the chaos of life. And I also had a narcissistic mom. Growing up knowing what is it to be a daughter of a narcissistic mother. All of this informed my work going forward. Right. And where I wanted to understand family systems, as they call it in psychology, which is the dynamics that happen inside the home between parents and children. So I specialize in child development and parenting. And that was the track I was on for a while, until I myself started to have my own children. And women were showing up in my office, either with pregnancy losses, miscarriage, postpartum. And I was like, oh, wow, that's a really interesting other area to go into. The grieving, maybe you had a traumatic birth, but a healthy outcome, or you got pregnant and you've had multiple losses and they don't know why, or you've had to go to infertility doctors to get pregnant. So we're brought up in society. So this is a whole nother topic to talk about another time with you. But, as women in our society, we're brought up to believe, you have sex, you get pregnant, you're going to have a baby. Not you have sex, you get pregnant, your baby dies. So this is a whole nother specialty area under my umbrella that I have taken in and work out of. I have medical staff privileges at St. John's here in Santa Monica as well. And I help the labor and delivery nurses and the NICU nurses and the postpartum nurses and the OBGYN department with their vicarious trauma, with everything that they see and with fetal demise. Okay, that said, back to, yes. So my experiences as a young woman definitely informed my work today and helps me be, I think, a more well-rounded psychologist. And also realizing as I went through, as we spoke before the show, my psychoanalytic training, I realized we're not neck up or neck down. That only takes us so far. And I realized that we're all energy, and I really believe in energy and science. And this isn't woo-woo. And even if it is woo-woo to you, it's not wooey, it's still energy. Right. Everything's energy. Everything around us is held together by chemical reactions.
Exactly.
From this computer screen we're staring at, to the chair we're sitting on, to the clothes we're wearing, everything is held together by chemical reactions that you do not see happening, but that's why we have things, right? We live in a dimensional world. So I really believe in vibration. Sound is vibration. We can heal through sound. There's so much science out there on sound healing. Just humming is good for your heart, and your heart has a bigger electromagnetic field around it than your own body. And how we need to really tend to our heart centers with love and compassion, like a garden.
Right.
And so I incorporate a lot of mindfulness. I'm a mindfulness teacher as well. And I incorporate a lot of mindfulness in my psychology. So I can be your typical therapist, but I can also, or I should say, and I add mindfulness into my work, which is so healing for people. They just immediately feel a sense of calm and ease in their day, even in their darkest moments.
Yeah.
That's really what my goal is how do I help people who are suffering and going through their darkest times,
right,
bring in more ease into their day. And even if it's just moments, that all adds up, right? It's all cumulative.
Exactly.
And helping people realize there's more to what the events in your life. They don't need to define you. They don't need to be in the driver's seat, that you're in the driver's seat, and how to transform trauma into something that you can use to help yourself.
Right.
And yeah. Okay.
Well, I mean, honestly, there's so much in there to even begin to unpack, but even just to go back and, look at what you experienced yourself as a teenager. I mean, I can't even begin to imagine how that must have been, how that must have felt. And then to lose your best friend in that way. And then those life events that happened. And I'm going to say for you and not to you, because I always truly believe that everything that we experience is a lesson. We might not see it at the time, and it might take us 20 or 30 years before we get to that place where we can look back with a different lens and say, okay, being able to utilize your experiences from the past, your own personal grief and trauma, gives you a completely different perspective when your clients come in. You're not just going through the textbook way of being a clinical psychologist. You are being the clinical psychologist as you have trained to be, but you are also pulling in from your own experiences, your own knowledge and grief and compassion, and know as a result of that there is so much more to healing rather than just the talk therapy and working with the mind, as you've rightly said. Knowing that the holistic side is so much more important, looking at the emotional body and working with the nervous system and really helping to unravel the damage that has been done.
Right. No, to know that we store emotion on a cellular level in the body. And that is also everything. I try to back what I say with science so that people can't say, oh, that can't be true. It is true. It is true. And we do have studies that are showing, obviously the benefits even of meditation, correct? Yes. So, and of gratitude, just, it's now kind of part of our vernacular, but before it was, people would look at you like, what do you mean? Like, gratitude is going to help me feel better in 28 to 38 days. And it does. I mean, UCLA has a whole program built around this, and,
that's it.
Anyway,
but that goes back to your point that you just said about vibration and how everything is energy. And when you are working from that space of gratitude and you are working with that grateful heart and that being grateful for everything, good and bad, because they're all experiences, they've all helped to shape you and shape your life. You are raising your vibration because that gratitude does vibrate on a much, much higher level and a much higher frequency than fear and shame and guilt.
Right.
And so when you're in that state, of course, it's not rocket science. It will affect everything else around you just because of that state of being.
Correct. Yes. My favorite quote is, death ends a life, not a relationship. And we continue to create connection and relationships with people even after death. And so there are gifts in loss. People look at me like I'm crazy sometimes. I say, you may not be there yet. I go, but one day you will understand that your stillbirth even to someone else's death or some other terrible event in your life actually there are gifts in loss. And what have you learned? Right. And usually it's deeper appreciation for life.
Yes.
don't suffer fools. Things that you thought were important aren't. Relationships always change. There's something called secondary losses in death, or around loss of any sort, or grief of any sort, I should say. And that is what happens to all your friendships, what happens to relationships at work, what happens to all sorts of different ways you never thought the world would respond or not respond to you, and show up or not show up for you. So it's complicated, but there are gifts in it that you realize that there is so much to be grateful for, even the simplest things in our lives. I always tell people, look, just start with the food you eat, the air you breathe, and the water you drink, to the bed you sleep in, to having a roof over your head, to, just start simple. It doesn't need to be some complicated, concept of gratitude, and to stay simple. That's and it. To write it down. And then also, before you go to sleep, think about what went well and right today. Because we're always talking to ourselves about what didn't go well, or what didn't I do today, or what's my to-do list for tomorrow. It's like, okay, write that out. I tell people part of their sleep hygiene is write out your to-do list, put it on your bedside table, and say, that'll be here tomorrow.
Yeah.
My body needs rest.
Sleep hygiene. I love that. I've not heard that term before, and I love it. Talk to us about that. Expand.
Sleep hygiene. So we all, I don't mean it judgmentally at all, but we all have a certain way in which we wind down in our evenings. And a lot of it revolves, I should say, around social media and television, something to do with the screen anyway. It's really important to know at least 30 minutes to an hour before, put it down. Don't watch the screen. Reading is underrated. Grab a great book. Journaling. You don't have to make it complicated. People hear journaling and they're going like, I don't have time for journaling. It's not about journaling. How about bullet points? Just bullet point it out. Just bullet point out your to-do list, and then the 3 things you're grateful for, what went well and right, and an affirmation of some sort for yourself that is incredibly positive. And you may not believe it, but write it out anyway. I love myself. I am incredible. I am, I attract really good people in my life. I am abundant. So starting out with simple but really great affirmations that put you in a higher frequency when you fall asleep. The frequency you fall asleep in is this frequency you're going to wake up in. So you want to elevate your emotional frequency so that you not only sleep better, hopefully, but you will wake up in a better space in terms of your mental frequency.
I love that. And especially what you just said, actually, is that even if you don't believe it, write it down. Even if you don't believe that you feel, even if you don't feel beautiful, or if you don't feel successful at the end of that day, write it down anyway, because what you think you will become. And eventually the more times you say it and the more times you write it down and start to think it, you automatically will train your brain to believe that way too.
That's correct. Your brain actually believes what you tell it.
But we forget that.
And people don't realize, we have, I forget how many hundreds of thousands of thoughts a day we have. But each of those are opportunities to reorient yourself. So if you have your first thought and it's not so positive, or it's not a good high frequency thought, what's your second thought? So you can have your first thought, which could be judgment or criticism or something not as positive as it could be. But what's your second thought? What could be your second thought? And your second thought can always be a place where you can elevate your emotional frequency.
Yeah. And how do you, how have you seen your practice shift, especially in the last 12 to 18 months? Have you seen people coming in with different issues and situations, and how, when people really are in the depths of the depths, do you really help them? Because it's different. It's all right us sitting here saying, just think positively and just say this positive. But really, in reality, it's a real process and a practice. How do you really get to the nitty gritty?
Yeah, it is a process. I mean, I don't have it in front of me, but I often say, if I had a magic wand, poof, everything would be easy. It's truly about a practice. When we say, do you have a practice, a meditation practice, for example? People say, well, some say yes, some say no, but most people don't. It's about, okay, how do I help you know what that means? And how do I help you to start practicing every day, putting aside start with 5 minutes, the phone, our phones have timers on them.
Yeah.
My phone. Phones have timers on them. So I have a couple of thoughts, actually. You said that. First, set your timer for 1 minute and see what 1 minute feels like just to sit and breathe. Just 1 minute. And if you are someone who has gone through trauma, it's better to leave your eyes open and gaze at a neutral object. If you're someone who feels safe and you're in safe surroundings, literally take your eyes and look around your space and room and know that you are safe. And then close your eyes. It's not silly. Your amygdala is always trying to pick up on danger. Yeah. What is our possible danger in our environment? So if you start with looking around, making sure you're safe, then close your eyes, push your timer, and just sit and breathe for 1 minute and see what 1 minute feels like. And then can you do 3 minutes? Then can you do 5 minutes?
I love that, because people say they find it hard to sit quietly and meditate, but I love that. But I think what you just said, which is really important, is feeling safe. And especially when people have been through trauma, it's that if you don't feel safe, you're not going to be able to relax fully.
No. And also, if you do, people in trauma should use guided meditations. So follow someone's voice. And what's lovely about all the apps now that we have available to us, you can pick how long your guided visualization meditation is. And if you can't stay with the voice, it's too long. Right. Your nervous system is saying, I can't sit and do this long. So pick a shorter one. And so really listen to yourself and be aware that you can still do it. It just has to be, you have to start with less time. And then the other, what else do I want to say? It's just about building up time. When if your nervous system's too activated, there's something called the tense breath, and I'm going to share it with your listeners. The tense breath is for people who have overwhelmed nervous systems, who can't seem to calm down or shake off a thought, a feeling, and are even people who have panic attacks, for example. The worst thing you can tell someone with a panic attack is to relax and breathe. The best thing you can do, you must use tension. You must tense up. So you put your hands into fists, you put your arms against your body, you tighten your core, and you tighten your butt and thighs, and you breathe in through the nose, and you go tight, 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 and you hold for 5. And as you exhale through the mouth, there's a reason, I'll tell you in a minute. Breathe out through the mouth and let all the tension go. Take one normal breath and do it again. Go tight, 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 and release through the mouth. And we'll do one more, breathing in. Tight, 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 and release. And then shake your hands, rub them together. Feel your feet on the floor. And what you've just done is, here's your brain, here's your frontal cortex. You've just put your frontal cortex back in place. When you're in trauma or anxiety, fear, all those negative emotions, you do something called flip your lid. Right. And your frontal cortex leaves the room. And then you use your ability to focus, concentrate, make good decisions, even take in new information. Your short-term memory is impacted. And this puts you back, it contains you, it grounds you. So this tense breath is so key, especially for women who need to go back into medical settings, or anything else that might be triggering, or you're about to see someone you're not sure you really, you don't know how the interaction is going to go, or anytime you're feeling a little anxious, like before a job interview even. So you can just use that. Also, the other wonderful thing to know is when you're busy feeling into your body, whether you're pushing on your fingertips or you're moving your feet on the floor and you're really feeling into that, you can't think. You can't think and feel at the same time. So it stops. It's called thought stopping. It's one of the, like a rubber band around your wrist. And breathing out through your mouth is like hitting the brakes on a car. It stops the parasympathetic nervous system from keep overwound. It stops all your thoughts. So that's why you breathe out through the mouth. So those are all quick little tips for your listeners.
But those are so powerful. I mean, literally just that tense breath, just doing 3 rounds of it, you literally can feel your entire body just completely calming down.
Yeah. You feel a shift.
Yeah.
You feel that shift. Yep.
Yeah, that's powerful. And I love this about you and the practice that you have, because you're not just a clinical psychologist licensed, like in the natural assumption of it. You do bring in all of these different techniques, and, to have your Reiki that you do and this breath work, I think is a crucial part of it.
Yeah, for sure. It's really, that's how you're going to help people, reorient to the present and be in the now. So temperature is another great way to, use hot or cold water. Cold water on your hands is great. Walk outside, just change your environment. The biggest word for people with trauma is the word choice. Never say, I don't have a choice. That immediately puts you into a trigger state. Right. You always have choice. Yeah. Even, to illustrate the medical setting again, you are choosing to go to the doctor because you need your body to be checked. Yeah. You are choosing to lay back down on that table where you found out your baby died with an ultrasound machine because you need the doctor to look at your body. So I'm choosing to lay back down on this table. So using the word choice really helps people with trauma. You must always have a choice.
And I guess it also triggers the safety piece of it as well. When you know that you have a choice, you don't feel locked or stuck. It's you get to choose. And I love that you say that. I think the 2 things that you just said there are to be present, to be remaining right here, right now, because, we hear this all the time. You cannot change what has gone before, and you have no idea what's going to happen in the next 5 minutes, 5 weeks, 5 years. There's nothing you can do. All you can do is stay present and remain grounded, and remember that you have a choice. You can't choose what happens to you, but you can choose how you react to it.
Respond.
Yeah.
I always say respond, not react. Don't react. If you're reacting, you're not thinking, you're not present.
Yeah.
You want to respond. You want to respond.
Present. No, you have choices.
Yeah.
Respond, not react. Love that. Beautiful. So I would say, what tips can you give the audience? But I think you've given so many literally in the last 5-10 minutes.
I tried to get as much in there.
Exactly. So just start slowly, take a minute, set your timer with the device that we don't want you to be using before you go to bed. But think about your sleep hygiene. Think about the things that you can control because you have a choice. Right. And remembering that, grief is not, just something that happens when you die. It can be so many different things, and acknowledging that and doing what you can to move through it and seeing it as a gift.
Absolutely. Yeah. I think you just summed it up.
Well, Ivy, it's been an absolute pleasure having you on the show. So you're in Santa Monica, but you also do now, obviously, Zoom work. You do it on this.
Globally. I run retreats when COVID's over. I'll get back into my retreats. I do speak at conferences all over. I've even spoken in Australia at a conference. So, I see people from all over the world.
Amazing. And of course, your podcast as well, Shattered Conception, people can find out on all of the different outlets that they get the podcast from as well. So
yeah,
you are everywhere. You are amazing. And you're a testament to the work that you've done for yourself and for your clients. You continue. I mean, you're just glowing. And
thank you.
So much love and gratitude for you. Thank you for taking
thank
time.
you. Same. Back to you. Back at you. Thank you, Jessica.
Thanks, Ivy. Thank you so much for joining us.
Of course. Thanks for having me on your show.
Thank you so much for joining me today. I truly hope that you enjoyed the show, and there is at least one thing that you can take away from today's episode that will help you build that sustainable healing toolkit. It would mean the absolute world to me if you would subscribe to the show, give it a 5-star review, and share this or any of the other episodes with somebody that you feel could really benefit by listening. I look forward to seeing you next time.